What's going on, everybody? It's Dr. Alex here. We have helped many patients get their thyroid health completely under control, and many have been bamboozled into thinking that they need to take something for the rest of their life to manage their thyroid before they even understood the causes, because their doctors just aren't investigating deep enough. So let's look into the 3 do's and don'ts when it comes to thyroid dis-ease. Well, of course, before we get started, make sure you're getting a full thyroid panel workup, because most endocrinologists won't even order a T3 free or check those antibodies or check reverse T3 to start understanding the complete picture. The number one causes of hypothyroidism is still Hashimoto's autoimmune, which is not a thyroid problem. It's just actually an overburdened immune system that has a heavy metal burden to the body the higher you see those antibodies. So especially watch out for exposure to mercury. So watch out for those fillings in the mouth. Fluoride, as fluoride is a neurotoxin, and there's other ways to protect and strengthen your teeth, as well as aluminum and chlorine could all be very damaging to the thyroid. So make sure you look into bioactive selenium to start taking, to start protecting your thyroid, especially if you have Hashimoto's. You may think you're doing yourself a favor by going low carb, keto, or skipping breakfast to lose weight and to reverse insulin resistance, which is actually going to do the opposite, especially with thyroid issues, because the thyroid is your metabolism. The thyroid relies on adequate carbohydrate intake from whole foods, not breads, not pastas, not empty carbohydrates, for the conversion of T4 to T3. Now, the second we start to get lower in T3, you get more brain fog, you get more issues losing weight, you get more hair loss, you get more cold hands, cold feet. So the best way to go about this is include some fruit in your breakfast routine, and maybe skip dinner here and there, or push that dinner back earlier so that your liver can get a chance to breathe and your thyroid can respond better in the mornings and not just have this constant elevated TSH and cortisol, which is going to happen with the lack of carbohydrates for breakfast. Now, gluten is going to be problematic for the thyroid, especially if you have Hashimoto's, as gluten fights for iodine receptors. Now, we all know iodine is essential for thyroid hormone production and function. So you got to cut out the gluten, and then also consider things like ginger and red light therapy. You got it. Ginger, some of the cheapest medicinal foods on the planet, whether you grate it into your teas, whether you put it into your soup, whether you sprinkle it on salads, whatever. Ginger is very pro-thyroid, and it will reduce inflammation to the thyroid and help increase thyroid hormone. And lastly, low vitamin D levels always disrupt healthy thyroid function. Now, I know we're getting into the winter months here soon, so look into red light therapy or infrared saunas, which can be extremely beneficial at increasing thyroid hormone function and also decreasing the inflammation and damage to the thyroid as well.